I did. And now we are in 2026. And so, like I said, I did feel fine for about 6-9 months after the surgery. And then I kind of started having some abdominal pain again. So I would mention that anytime I was at appointments or different things. Again, blood work was fine, scans were fine. So they suggested I follow up with a GI. So I've kind of spent the last year doing different tests and things with the GI. There were non-cancer related things found, but as far as cancer goes, they weren't ever worried that they had seen anything at that point, even though I was still having a lot of symptoms. I continued to follow with my OBGYN and also kind of just letting him know some of the lady symptoms that I was having, mostly pain and irregular bleeding. And so beginning of this year, he decided it was best to do a hysterectomy, which I had March of this year. And so he did remove my uterus, and during that procedure he saw a cyst on my right ovary. He said it looked pretty normal in the cyst world, but luckily, knowing my medical history, and he calls it my crazy cancer, he decided to do a biopsy. Again, pathology came back, and they did let me know that my cancer had returned on my ovaries, and now it was showing signet cell features, which essentially means that the cancer has mutated. It's now become more aggressive and sneaky. So I then went and followed back up with the specialist, and that's where we recently in June had a CRS surgery and the HIPET procedure. So the CRS part means that they just go inside. What makes this cancer very difficult to treat, some of them you'll see, I'm sure you probably read, it's called the invisible cancer. So it's very hard to find on scans, PET scans, MRIs, CAT scans. I've had them all. I even had a CAT scan in March, and it did not show the cancer I had, and the tumor on my ovary was pretty significant. It was almost 6 centimeters when it was removed. So it was fairly large, but again, these scans weren't detecting anything. So luckily, I had that procedure, and they were able to find it. So I did go in, and the CRS piece means you kind of got to be prepared. They might not know how bad the tumor burden is until they look inside, and they will remove anything that they need to, anything that doesn't look right or is not colored right, or if they have any concerns. So some patients wake up, they don't have spleens, gallbladders, some have ostomy bags. So there's a lot of things to be prepared for. I fortunately